Hello class, my name is Emily Parsons, and for this week's discussion post, I will be discussing the importance of communication relating to the nursing profession. Communication can be defined as the exchange of information, thoughts, or feelings through a variety of mechanisms. Good communication involves verbal, nonverbal, written, and active listening skills. It has been proven that when the nurse communicates well, it improves patient outcomes, increases job satisfaction, and boosts morale. It is important for the nurse to communicate complex information with patients and their family members in a way that they can understand to fit their individual needs. I've personally experienced patients tell the provider that they understand their treatment plan, and as soon as the provider leaves the room, the patient will turn to me and ask me to explain it in more simpler terms. They were just too afraid to ask the provider to explain it for a third time. Whenever family members call for updates, I also make sure to ask them before hanging up the phone if they have any other questions or concerns. Sometimes when I do this, the family members will share information with me that I previously didn't know. For example, I had a family member to tell me that the patient I was taking care of was addicted to sleep aids. She told me that she had found a variety of NyQuil and Benadryl and other over-the-counter medications hidden throughout his home, and he's been addicted to it for years. They didn't feel comfortable telling any other nurse that except for me, and the patient also did not disclose this information to me. It was important to add to his treatment plan though. So in doing these things, the nurse can build a good rapport with the patient and the family members, and it makes them more trusting of not only the nurse, but also the care that the nurse provides to them. Along with providing clear and concise communication with patients and family members, it's also important to provide the same communication skills with providers, specialists, and other coworkers. Poor communication within the interdisciplinary team can lead to decreased patient satisfaction, delay in treatment, prolonged hospitalization stays, slower recovery time, or even sentinel events. Some barriers that may contribute to poor communication include language barriers, information overload, short staffed accompanied by increased stress, and just a lack of general confidence. One thing that has drastically improved communication skills between providers and nurses at my hospital is the American Messaging System, or AMS. This is a secure text messaging application that allows you to communicate with multiple team members on your smart device. This has been helpful because it reduces callback times. You can clearly see what the provider is ordering. There's a timestamp as to when you communicated with the provider, and it is seemingly less stressful to text someone rather than to pick up the phone and call them, especially if there is a language barrier. Again, adequate communication skills are an imperative part of the nursing profession, and we should strive to improve these skills during every shift that we work. Thank you for listening and have a great day.